As the heart beats, it pumps blood through a system of vessels called the circulatory system. Arteries carry blood away from the heart, while veins return it. Dr. Milton Conley of Desert Regional Medical Center in Palm Springs explains the importance of keeping this system running smoothly.
Vascular surgery deals with blood vessels exclusive of the heart. There are a number of different areas. The carotid arteries, which run in the neck and supply the brain with blood, can become blocked and put the patient at risk for stroke. The aorta is the largest blood vessel in the body. It can also become blocked or it can become weakened. The weakening is called an aneurysm, and this is at risk for rupture and life-threatening bleeding. We also deal with the lower extremities, the legs. People can have difficulty walking or even changes in their legs which suggest that there is profoundly reduced blood flow. We have ways of improving blood flow to the legs. The first line of evaluation is the history and physical examination. After that, ultrasound, CT scan, and magnetic resonance angiography are the methods by which, in general, we're able to evaluate the extent of blockages in the arteries. Arterial blockage, and we'll talk about carotid, but it pretty much goes across the spectrum, is a disease of aging. Most patients are 60, 70, 80 years old, sometimes even in their 90s. Risk factors for arterial blockage are diabetes, hypertension, long history of smoking, hypercholesterolemia. In other words, the blood cholesterol is high, especially the bad cholesterol. And there's also genetics. Many people have a strong family history for blood vessel blockage. And all of these factors can be modified in the patient's favor. It takes some discipline, except for genetics. What patients have to understand, though, we can fix their arteries, but they need to change their lifestyle also. If they smoke, they need to stop. If their diabetes is not under good control, that needs to be controlled through diet and taking medication. The same goes for high blood pressure as well as cholesterol. We encourage lifestyle modification because whatever we do may not be permanent and often is not. We can clean out an artery, but it can block up again if the patient continues in their way of life with regards to these risk factors. I generally am very conservative in recommending surgery, especially in higher risk patients. We have to look at all angles of the problem, and if there's a non-surgical option, we'll encourage that. And I will often spend half the office visit discussing with the patient the importance of lifestyle modification. If they do this, often surgery can be avoided. If they don't do it, I can almost promise them that they'll be back requiring surgery in the future.